Hey guys, Don here. I want to talk to you today. I was talking to a doctor yesterday, um, Ryan. He's just been out of fellowship for about a year. Works in a multi-specialty practice. Really sounds like he has a great gig. I think he's about 100 doctors referring just to him. He's the only one in the group, and it's just a great opportunity. The problem is he's struggling with wanting to start to increase profits, and he can't get into any high-tech things yet. So basically, we're going to talk about low tech ways to increase your profit. And as I was talking to him, I realized that not everyone's able to do a shock wave. Not everyone's able to do a diagnostic ultrasound. Not everyone's able to do some of these higher ticket items that really produce and generate a lot of revenue for your practice. But let's talk about a few things. So I was talking to him, and he's saying orthotics. So orthotics is one thing that he does, and I think all of us do. So that's something really kind of a low tech item. I know it's a little higher tech. There's different ones where you can do plaster cast. We have one we use that's called forward motion. I'll put a little link underneath it. That's the one we use. We used to use another one with Northwest, and they do a really great job. The challenge was their scanner in the time would just give us too much of a headache. And we switched over to this other one because of the scanner. Basically, the scanner is a lot easier to do. We teach our staff to do it. I think they almost give you the iPad, or you buy an iPad. So it's a really easy way to start. And you can do it, and you can kind of learn how to do the orthotics and kind of determine what diagnoses you need to do orthotics for. So that's one, doing orthotics. Now, the main thing when I was talking to him, I realized is he was charging $300 for his orthotics. You probably get them for about 150, maybe 125. You should. 300 I think is way too low. We charge 550 where we're at in Worcester, Massachusetts. I don't know if any guys are probably doing more. Some are probably doing less. But it's all the value that they perceive with the orthotic, right? So I think the 300 is just a little too low. So another way of increasing his profits is just to raise the price. Okay, that's when you study about business, the easiest thing you can do is just raise the price, because price is very elastic, meaning it's all the perceived value of the patient. And if they get the benefit from it, they don't care. It's kind of like when you have a sore tooth. Like, what are you going to pay? You don't care if it's $200, $300, $500 to get rid of that tooth. You want to get rid of it. Okay, so that's one thing, just increasing the price. So the second thing was just increasing the price of anything that you do. Recently, wanted to reduce the amount of routine care we did. And we've tried a couple of things with routine care. So it does produce some cash, but we didn't want to be known for that. So the two things that we did is we did block time. So the doctors only have a half day a week doing routine care. And the other thing is, so I have one day, they have half day, and the newer ones that just started. And we also raised the price. So I think we're doing it now for $65. Now you might think, oh, that's really expensive, but the higher you raise it, you're going to not have as many of those other patients that are price conscious. Okay. Another thing that you can do to increase the amount of what you do would be adding some simple things that aren't that expensive. So something called OniFix that I do, I'll put a little link on it. Basically, it's this bracing system that goes on the outside of the toenail. And this is something that patients come in for an ingrown toenail. So sometimes if it's really infected, I'll do a paronychia. But if it's not that bad, if there's like callus in the edge, I will just apply this OniFix. I'll trim it out, make them feel better, put this OniFix on. And usually it's 3 to 4 applications, leave it on for 3 months, and I guarantee it. So if it falls off, I don't charge for the next one. And I charge $125 per application. And so that's something that it doesn't really cost that much to get started with it. But then afterwards, it produces a lot because they come back every 3 months for the routine care. I'm still kind of learning it. I've applied maybe 30 or 40 of them, but it's something that does produce in your office, and it's kind of low cost. Okay. Another tip for Ryan here, who I'm talking to, would be to this is something I've learned only recently, is when you're treating most musculoskeletal issues like Achilles tendonitis or plantar fasciitis or things like that, I used to kind of just almost, they're drinking out of a fire hydrant. Okay. So what happened is they came in, I said what they have, why they have it. I did the x-ray, I did everything. I did them a cortisone injection, gave them a night splint, did all these things, and they were really, really overwhelmed. And I know we want to provide our patients value, but one thing that I found that's really helped me spend more time and really explain things better is having that first visit only kind of like as a consultation visit. And yeah, you're not earning as much. You're earning your x-ray your x-ray visit, your office visit. You're not doing a ton of things the first visit, but you're going through the whole plan. And that plan is what I go through, which I call the patient presentations. And that's that presentation that I have on plantar fasciitis. I'll go through all of that and I'll say, okay, this is the plan. Now, occasionally, if they're in really, really bad pain, I might do a cortisone that day just to kind of calm the things down. But I don't do as much cortisone, and then I'll set them up for the shockwave. I'll set them up for the plan. I'll get them into physical therapy. I'll set up this whole treatment plan. It lets you spend a lot more time with patients, and it also gets another visit that they'll come back for then for the other treatments, whatever those may be. And that's something, and I also do, so that's the first visit consult. The second thing that I find that really works is I do a yearly comprehensive diabetic foot exam. So every year I do I think it used to be a level 3, now I think it's a level 4 office visit with this new coding system. And I just go through, I have a little system I go through vascular, derm, musculoskeletal, neuro, kind of go through it, and I do some education components, send them some information, and that's my diabetic foot exam. The easiest way for me to remember when to do it is I do it a month before or a month after their birthday. That's how I do it, just so I put them all around that time. So once a year, I'll do the comprehensive diabetic foot exam at that time. So all of them are having it at a different time. So that's another thing. And the other thing that I do is a pre-surgical visit. So these are just extra office visits that you can do. So before a patient comes in for surgery, let's say 30 days before, I'll have them come in, we're signing the consents. I have another presentation that I do, which I've talked about. It's the pre-surgical discussion. It basically goes over all the details. I really, really try to scare them, and I go through everything, what could happen. They sign consent, and that's another office visit. So another thing for you that you could do is just do more office visits, okay? A few simple things that you could add are some simple, not expensive products to start. Like everyone's doing ingrown toenails. So what you do is you get that Amerigel post-op kit and you have them buy that. That's an easy way. I know another doctor, Dr. McCann, who I was talking to, he has the post-op kit for the matrixectomies, but he also has a little kit. I think it's a little less expensive. It basically has some gentamicin in there and some gauze and everything that they need. It's lesser than the Amerigel kit, but it's still something that every patient can get. It has like maybe a soak in there and then some triple antibiotic and things like that. So it's something else that every ingrown toenail can get. So that's something else that you could do as well. I know one thing that also can help you in terms of increasing the profit in your practice would be biopsying. I don't know if you already biopsy as well, but doing a biopsy on anything either that isn't responding to a topical or some type of previous treatment, or you're just unsure. I tend to do a lot of biopsies for eczemas, tinnias, dermatitis, things like that I'm not sure. It's kind of beyond the scope. I'll do a kind of a longer one later on where we'll talk more about biopsying, but biopsying is something that's very helpful. And then the last thing I want to talk about is amnio, finding an amnio company. If you believe in that, if you think that works for you, you buy it and then you increase the price of the amnio if you find a good product. I was talking to Chris Bromley, and we've talked about him. He doesn't like Shockwave because it's so many visits. He prefers amnio, and that's the way he does it. The amnio that I use is the right amnio. It's like $1,500. That's what we charge. So it's harder. It's a harder thing for me to have every patient do. The Shockwave is a lot easier for me with the patients. I'd like to know your experience, what you guys are doing, kind of, is all amnio the same? I don't think so. So I try to get the good stuff. But if, I'd like to know other people's feedback. Feel free to reply. And then the last thing, I know we talked a little bit of, it can be a little bit more work, but is in terms of increasing revenue that doesn't cost too much, would be doing more in-office dispensing. So buying certain things that you really believe in, start with a few, like the Amerigel post-op kit and a cream. Those are the two easiest things to start with. And then also durable medical equipment. So if you're part of a medical group, they're probably already doing durable medical equipment, and that's something that could increase profits for. So that would be diabetic shoes or AFOs or other things like that. Those are easy things to add. As an added bonus, I was just thinking about this, and I'd like to know from the reps at Curamedics or Shockwave or EPAT what they think. But he has a hard time in his office getting Shockwave in there because of the price tag. And I recommended to him, could you ask Shockwave or EPAT to lend you a machine, to use your machine for 30 days, do it on your patients. I don't know if do it for free or charge your patients. My thought is to charge, right? Do your 150 per doing both shockwaves. See how much you produce in that month, and then see how much the ticket is at the end of the month, how much your payment is for that machine. And if it makes sense, you just go to your group practice and you say, hey, I'm doing this for 30 days. This is what I've charged. Like the payment's 800, I've produced 2,000. It should be a non-issue for you to produce enough with the shockwave if you know how to offer it to your patients. So those are a few thoughts on this aspect of how to do some low-tech ways to increase more revenue. Hope you found this helpful. Please subscribe here to this podcast. Also, please come to the next group session. You can learn more at podiatrypracticemastery.com. I'd love you to come there, get the group sessions. And when you sign up there, you can get access to all the other older sessions and other types of helpful information. If you liked it, also just let me know. You can send me a message. Any other topics, reach out to me. Let me know what you'd like to learn more about or things we could talk about. Okay, thanks, guys.